Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, treatment of the dry eye. So, in the dry eye, if we see the treatment of dry eye, in the treatment we can give tear because it is a dry eye. Tear substitutes can be given. Tear substitutes are actually made up of either cellulose derivatives or polyvinyl alcohol. Tear substitutes can be given. Mucolytics can also be given, that is actually 5% acetylcysteine drops can be given, or we can give reduction in tear drainage should be done by punctal occlusion. We can occlude the punctum so that the tear drainage is reduced, so dry eye can be decreased.
thank you and thank you for watching.